Hello and welcome to yet another episode of Health Par Charcha. My name is Meenakshi and today I have with me Dr. Himani Pandey, Lab Head of Clinical Genomics, Redcliffe Labs. Today, on World Autism Awareness Day, we'll be delving into the crucial topic about autism and end the misconceptions surrounding it. Hello, ma'am. Thank you so much for joining us. And my first question to you is autism genetic and passed from parents to children?
So autism, it's a neurodevelopmental differences which that seems to begin before the birth, and there is a prevalence about the autism. 1 in 100 children, a child has autism. So this is estimated, and autism spectrum disorder has tendency to run in the families, but the inheritance pattern usually unknown. And people with gene changes associated with ASD generally inherit and increased risk to developing the conditions. So there are more than 1000 genes which are associated with the ASD, and the genetic factors are estimated to contribute about 40 to 80% of ASD risk, and many genes which are associated with ASD, so these are involved in the developing the brain.
So, ma'am, can environmental factors and stress during pregnancy cause autism?
Yes, maternal mental health is also influence whether a child born autistic. So there was a study in 2018, so they have included 1,95,000 mother and child pairs. So in this study they have revealed that the child chances of autism in the child is more influenced by the maternal depression during the pregnancy. So बहुत सारे एक्सपोजर भी है, लाइक maternal exposure, like air pollution, pesticides, और कुछ मदर्स लेती हैं सप्लीमेंट्री लेती हैं ड्यूरिंग दी अर्लियर प्रेगनेंसी जो होता है, तो वो भी काफ़ी ऑटिस्टिक को कॉज करता है. एंड हम लोग देखते हैं कुछ पेरेंट्स बहुत लेट में शादी करते हैं, सो इंक्रीज पेरेंटल एज and the short duration between the pregnancy is also have been associated with the ASD.
So, ma'am, what are the problems usually faced by an autistic child?
Yeah, they have problem with the social communication, interaction, and restricted or repeated behaviors, or like they have less interested in anything. So the autistic child may be difficulties developing the language skills, and बहुत बच्चे ऐसे भी होते हैं जो एक्सप्रेस नहीं करते हैं, वर्बली एक्सप्रेस नहीं करते हैं, एंड हाथों से बात करेंगे, आई कांटेक्ट नहीं करते हैं, और लिमिटेड उनका इंटरेस्ट होता है, वो सामने वाले की बातों को नहीं समझ पाते हैं. सो देयर आर मैनी फीचर्स ऑफ ऑटिस्टिक चाइल्ड. Some children with ASD is not able to communicate using speech or language, and they seem very limited speaking. They have very limited speaking skills. And people with autistic, so there are many co-occurring conditions is there, like epilepsy and seizures, depression, anxiety, and hypertension, hyperactivity. So there are many signs and symptoms which we can see in the autistic child.
So, what are the early signs of autism?
Like delayed language skills, and delayed movement skill, and delayed cognitive and hearing skills. So unusual eating and sleeping behavior can be seen in this autistic child. They have also a gastrointestinal problem like constipations, and they are very impulsive and inattentive behavior we can see in the autistic child. Also they are not responding to the name by the age of the 9 months. Also they are unable to express their feeling like sad, happy, surprised. So there are many early signs and symptoms can be seen in the autistic child.
So, how can we as community support people suffering from autism?
So education and training program is there. So there are many school and programs. They provide the education and the training for the people with ASD, and these programs can help to provide people with ASD so they can develop their skill, and they need to success in school life, work life, and normal life, and social support. Yes, they really want a social support, so there are groups and organizations provided the social support for the people with ASD, and this group can provide a safe and supportive environment where people with ASD can socialize and make friends, and recreational activity, and there are many recreational activities so that people with ASD, these activities can help with ASD. With people with ASD can stay active, they can have fun, and they can have like learn new skills, and advocacy is must for the people with ASD, because there are many organizations that advocate and the rights of the with people with ASD, and these organizations work to ensure that people with ASD have access and services and support they need.
So, thank you, ma'am, for all the insights. One message that you would like to share with our audience.
So there are many misconceptions about the autism. So my message is that ki just take a expert advice, and so that the doctor looks at the child behavior and the development to make a actual diagnosis.